I would like to take you to the workplace health model that Percon has created. Our organization has created a model so that implementation takes place easily. So start with the assessment of the situation, assessment in the organization, what is the present state, then a lot of planning and management to take care of after the assessment is done as to what part has to be planned, what part is to be strategized, what work has to be done, etc., etc. Then, of course, it's the uh, implementation. Implementation is a very important aspect in this, but where the planning and management has to be very, very robust. You see, before implementation, I think planning and management takes a lot of time, and implementation can happen effectively if the planning and management is robust. After the implementation is done, then we do the evaluation. Whether we have been able to remove the gaps or we've been able to minimize the gaps or they continue to be the same. So this is how it is done. This is the workplace in picturized here. We have workplace in terms of an office, factory, IT, and we have sanitizers being displayed to show that this is the kind of norm that we have to live with, the new norm, as they say. So it is this assessment, then planning, then implementation, and then evaluation. So this is how we do the 4 steps we carry out. In assessment, what we do is we actually look at the individual, find out the kind of demographics, their background, their social background, their health risks and use of services, organizational current practices, what are the work environment and infrastructure, and of course the community, which is the hinterland around the organization, how transportation takes place, how food, of course, Mr. Das is going to cover this area in a greater detail, but I'm just going through what we are doing. So in planning and management, what is most important is the leadership support. We do not want entrepreneurs who want to keep their toilets locked. So we want to have entrepreneurs who are role models themselves. They walk the talk and they become the change champions. Then the management has to work out their coordination. Management has to work out their committees who are actually taking care of the planning and management and how it is to be carried forth. What are the improvement plans? That is worked out by the leadership team, the management team, that very specific goals and strategies are worked out. Then dedicated resources that have to be taken care of by this planning in this planning and management area. Dedicated resources would be the costs involved, the partners, who are the vendors, who are the partners, who would you associate in order to implement things, and the kind of staff that you are going to use or for this implementation work. Communication is again very important. As I was mentioning in my previous slide, we talk about dashboards, we talk about communication to the entire organization, messages and systems. Most of the problems happen because the communications are not clear. Now, in implementation programs, we have education and counseling, we have policies, organizational rules are to be framed and implemented. Benefits, what are the incentives and the insurances that are introduced in the organization so that people are incentivized and they feel motivated to follow the program or implement the program. What is the environmental support that the organization provides? What are the access points? What are the opportunities? What are the physical and social measures that you take in terms of providing the environmental support. So it's the organization environment, workplace environment, which has to be very, very conscious and very alert to cater to the needs of the situation. Then worker productivity, where this is the evaluation after the whole thing happens, then we are actually evaluating, and because we have to see whether we went the right way, and then worker productivity, absenteeism and quality deviations are the tools or the measures by which we know what is the worker productivity. Then healthcare costs. What is the costs involved in the quality of healthcare and the performance standards? So quality of care that is provided and the performance standards that are maintained. Improved health outcomes. So reduce disease and disabilities. And that means we have more of wellness in the organization, which Santosh is going to talk about. And lastly, it is the organization culture of health. So this is the culture in the organization that evolves if you do this as on a regular basis. And one cycle, 2 cycles in an organization will actually build that organizational culture of health. So this is what we have designed in PERCON. I'd like to quickly mention about the contextual factors. You see, this entire workplace health model is actually dependent on the organization size and the vertical in which we are talking about. Is it a pharmaceutical industry? Is it a steel industry? Is it a call center? What is it? What is the workplace? What is the vertical? That is also important. Then we have the capacity and the organizational capacity. Is it a very small organization, financially not very sound, something which is very, very profitable? So organizations will also vary. So therefore the context will also vary. The location will also be very, very important. So this is what I had to present, and I've just given you an overview of what the organization, what this workplace health should be. Now